So now we're ready to get things started with the CQL Accreditation Difference. I'm going to hand things over to Elizabeth Seitz, who is CQL's Director of Organizational Excellence. Elizabeth?
Thank you, Seth. So welcome everyone to today's webinar. As Seth said, the CQL Accreditation Difference. Again, my name is Elizabeth Seitz with CQL, and I am here today with my amazing CQL colleague, Nikki Anderson. And we also have some guests from one of our accredited partner organizations here with us today, Albertina Kerr. And I will let them introduce themselves and talk a little bit about their organization.
Great. Hi, everyone. My name's Eli Toombs. I'm Albertina Kerr's Best Practices Manager. I helped facilitate our self-assessment and accreditation process with CQL last year, so excited to talk about it today.
Yeah, hi, everybody. My name is Caitlin Winter. I'm the Associate Director of Person-Centered Systems Integration here at Kerr, and I'm excited to share with you all the wonderful things that CQL has done for us.
And hello, everybody. My name is Owen Gibson. I'm Kerr's Chief Quality Assurance Officer, and I've been with Kerr for 17 years. So I'll talk for a minute about Kerr and our history, as we've been around since 1907. So Alexander Kerr started Albertina Kerr as a nonprofit serving homeless men in the Portland area. So for those of you who have canned fruits, vegetables, or jams, have probably used either Ball or Kerr jars, which were the better ones, during that process. So this was the main business of Alexander Kerr in 1903 in Portland. So he was a very successful businessman who saw a significant need in the community. Some people have asked where the name Albertina came from, and Albertina was Alexander's wife, who passed away early in their marriage, and he named the nonprofit in her memory. So 50 years, Kerr's primary mission was facilitating adoptions in the Northwest. And in the 1960s, we transitioned to providing services for children who were struggling with some pretty significant mental health challenges. In the 1980s, we were one of the leaders in helping Oregon close down really a large institution in the middle part of Oregon that really essentially warehoused people with intellectual and developmental disabilities. And we helped facilitate move them into much smaller home-based group home settings located throughout the state. Also at that time, we started Crisis Psychiatric Services for Youth, which is a short stay facility of 2 to 3 weeks here in Portland that really helps youth with significant mental health challenges return to home. So we recently, about a year ago, we merged with Exceed Enterprises, and we now have a large program of supporting people in job training and placement, and we're now the largest nonprofit IDD provider in the state of Oregon. So Albertina's Kerr mission is to empower people with intellectual and developmental disabilities and mental health challenges to lead self-determined lives in their communities. So for us, our services range from group homes to employment to day services to youth outpatient mental health and short-term mental health crisis stabilization. So we're really taking the lead in Oregon in providing both IDD and mental health services to youth in our group home settings. We really believe that this coordinated care system is essential to providing effective services to the people that we support. So I'll hand it back to Elizabeth to talk more about CQL.
Thank you so much, Owen. So CQL's vision is a world of dignity, opportunity, and community for all people. Along with our mission that we are dedicated to the definition, measurement, and improvement of personal quality of life. Now, over 460 organizations have achieved CQL accreditation across 25 U.S. states, Canada, and Ireland. This also includes the state of Tennessee's IDD system. Now, as you can see on the slide, there are many values and benefits to accreditation with CQL. But as this is the main topic of today's webinar, we're not going to go into a lot of detail here. Instead, we're going to spend the next hour chatting about all those values and benefits. Now, first, before we go into what makes CQL different, let's understand why accreditation is important. First, through an open, honest, and unbiased evaluation by outside experts, accreditation equips organizations with valuable information and action steps for improvement. Second, when organizations rely on their own internal review of operations, they may unintentionally allow the investment they have in their organization to influence their outlook. And last, internal reviews also limit an organization to its pre-existing base of knowledge, whereas accreditation aggregates best practice from other organizations, including those 460 plus CQL accredited organizations. So with CQL accreditation, we're looking beyond compliance and going beyond regulatory requirements. Typically, as you all know, regulatory bodies are focused on rule compliance, which is important, but it shouldn't be everything. Though there are certainly some similarities with using basic assurances, CQL accreditation goes beyond regulatory compliance. We examine best practices and support an organization to continue its quality journey. And this is done through the use of the fundamental non-negotiable requirements of the basic assurances. We are inclusive of all stakeholders. CQL's accreditation activities ensure a diverse set of stakeholders are involved, including people receiving services, their families, direct support staff, supervisors, executive leadership, community members, and more. These groups can be included throughout the entire accreditation process, from the planning calls to factor discussions, opening meetings, interviews, visits with people, focus groups, and stakeholder meetings. Now, by learning about and understanding the perspectives of a variety of stakeholders, CQL can give a more holistic view of the organization and its services. Basic assurances are fundamental non-negotiables that go beyond what is required by any regulation. They are based on best practices as we see across the US, Canada, and Ireland. They are rigorous and holistic standards that challenge providers to keep striving for higher quality services and supports. CQL is also committed to understanding the legal, regulatory, and other barriers that providers face as a part of service provision. We support providers to find effective strategies to push through those barriers towards continuous quality improvement. Accreditation with CQL is not just a one and done to-do list. Our strengths-based approach, CQL does not expect perfection. We'll meet you where you're at and help you move to a better place. There is not a set percentage of standards that need to be met, but we do expect measurable progress with responsiveness, follow-through, commitment, and transparency from our partners. Our mantra truly is progress over perfection. Now, using the personal outcome measures, we learn what is most important to people and what type of supports are put in place to help people achieve their personally defined outcomes. It is, after all about the people that receive the services and supports. Now, let's begin to explore the impact CQL accreditation has had with Albertina Kerr. So, Eli, what impact did the inclusion of a variety of stakeholders during the accreditation process have on your organization?
Yeah, well, when we did our self-assessment, we opted to pull together a team of approximately 30 of our staff to contribute. And these were staff from all various different types of roles, both administrative, direct support, and everything in between. So I think this had a couple effects. I mean, first of all, it really helped us bring different parts of the agency together. A lot of people throughout those various roles got to see a high-level overview of how the agency functions And in addition to that, more administrative roles got to see and hear more about the direct care or day-to-day services that we give to those in our support, and also vice versa. So that was really cool to see. Including a lot of these roles in the process helped educate a large portion of the organization on like what CQL is, why we're seeking accreditation, why we're seeking to make these changes as well. So it was a really helpful tool in educating the organization on CQL and what we're doing. And finally, and probably most importantly, the person-centered nature of the self-assessment helped orient us away from a top-down approach of only policy and procedure or only regulation dictating our services, and put more of the emphasis on how do we learn about what people in our services are wanting and needing, and how do we make that drive our policy and procedures.
Hey, thank you, Eli. What shifts in supports systems and or practices has Albertina Kerr made since it began learning about and using the basic assurances?
Yeah, we've made a lot of changes we're really excited about. Some were, pretty simple. We started with like general policy updates to make our stance on rights more robust. We drafted policies in accessible formats using simpler language, pictures, things of that nature. One of the biggest things we've implemented so far is we've began our Human Rights Committee. So our work in that has been like gathering info on the scope of rights restrictions throughout our agency. What will due process look like for future rights restrictions? We've begun to create rights education materials, both for staff and for supported people. And we've also put out a survey to determine staff's understanding of rights throughout the agency, so we kind of know where to focus our educational efforts. We also have a self-advocate committee that we've been, continuing to grow and refine. This is composed of about 8 people in our services who we're paying to help inform us on service decisions. And they're also kind of working as peer mentors to ensure that people are directing their own person-centered plans. We've also started a personal outcome measures committee. So everyone on this committee has taken the week-long personal outcome measures training offered by you all. And we've just started initial discussions on how to, integrate the personal outcome measures occur and how we're going to use that data. We've made changes in staff recruitment and retention. One of the things we've done that I'm particularly excited about is we've started to revise our hiring process for direct care staff. And right now we're discussing with our HR department on how we can include more supported people or more of those hired peer mentors into our hiring process, so people have more of a say in who's actually getting hired to, provide care for them. We've implemented short form manager trainings to help our leaders develop professionally, even though they are very, very busy. And we're updating job descriptions to make sure they're accurately representative of what people's roles actually are. And one thing you might be very happy to hear about is that we're going through some electronic health record changes at the moment as well. We were previously across the agency using a more medically focused electronic health record system, and it was quite complicated to train and to use. And so we decided to start a committee that would kind of review how best to proceed if we were going to continue using that or choose another system. And we opted to choose another system that's going to allow better communication and more consolidation of records. So it should be much easier to use for everyone. And then kind of just overall, our partnership with CQL is quite new. But I am starting to get more calls and hear more folks say like, oh, is this CQL approved or is that best practice? So I know changes like this throughout the organization take a lot of time, but that's really thrilling for me to see people, start using that language or having the CQL sort of experience seep into our culture a little bit more.
Hey, very good. Thank you so much, Eli. That was so great to hear. Now what I'll do is I'm going to turn it over to Nikki.
Thank you, Elizabeth. Hi, I'm Nikki. I get to talk to you about building strong partnerships at CQL. Collaboration and support are really at the core of how we engage with organizations. The accreditation experience with CQL doesn't begin and end with just your on-site visit. CQL really embraces a partnership with those that achieve CQL accreditation throughout the entire term. So that's offering support, guidance, resources, check-ins, and insight. We don't show up with a script or a one-size-fits-all plan. Our goal is to work with you, building on the strengths that you guys as an organization already have and supporting you to move forward. We learn from you just as much as you learn from us, and that's kind of what makes it a true partnership. When challenges come up for you, and they always do because real growth isn't typically easy, we're not standing on the sidelines. We're going to be right beside you, helping you to figure it out, providing support, or connecting you with other organizations if needed. To us, that level of collaboration creates stronger organizations, stronger services, and most importantly, better outcomes for the people you support. Some of those additional perks, if you will, of partnering with CQL is monthly topic-based webinars. We have a lot of capstone newsletters, articles on topics that are affecting most organizations. We have research briefs with powerful data. We, again, help you network with other accredited organizations. You have consultation with staff and assistants, and then you can also get some discounts on CQL training and personal outcome measures certification. The next piece of building strong partnerships is our culture of lived experience. Another huge part of what makes us different, is our culture of lived experience. We know that the best insights often come from people who have already lived it. People who have navigated the services, probably faced the barriers, celebrated those victories, and experienced the gaps firsthand. CQL reviewers are all paid staff, not volunteers, and this really ensures that professionalism and accountability for our work. CQL's quality enhancement specialists have diverse areas of expertise and work with hundreds of organizations across the globe. In addition, all CQL staff have practical experience in the disability services sector, representing a wide range of roles, from a lot of them starting as direct support professionals, supervisory positions, quality assurance, and all the way up to executive leadership. This keeps our work real, practical, and grounded in what truly matters, not just what looks good on paper or might satisfy a policy. This also allows us to assist organizations to meet the real needs and help make real impacts, and continuously grow in ways that are meaningful to the people that you are serving. It builds deeper trust with people receiving services. It tends to help uncover opportunities for growth that might otherwise have been missed, and creates a culture where people feel heard, valued, and empowered. Organizations gain a deeper insight into truly what's working and what could be better, often in ways that a traditional audit might miss. The next piece is we are not a one-size-fits-all approach. One thing you'll notice right away when you start working with CQL is that there is no one-size-fits-all mentality here. We truly recognize that every organization and person brings something unique to the table. While we are grounded in the integrity and framework of the basic assurances, we recognize that how these assurances come to life will look different depending on your specific needs and goals. We take time to really understand where organizations are at and what matters most to the people they support. When we work with organizations to build a path that fits, a path that's flexible, creative, and makes sense for your organization, not just a generic model. We want to ensure that your organization's identity and priorities are reflected in the solutions we develop together. This way, we're not just pushing compliance, we're helping you grow in a way that's meaningful, sustainable, and aligned with your own missions and values. And when the solutions actually make sense for your organization, that's when you can actually see real engagement, real progress, and real and lasting change. And then finally, prioritizing what matters. Finally, we are intentional about prioritizing what matters most. It's easy to get caught up in policies and processes, but we stay focused on that big picture, those areas that have the greatest impact on people's quality of life. Whether it's strengthening human rights policies, enhancing personal outcomes, or even building a more inclusive culture, our priority is always to support meaningful, lasting change where it counts most. We work with you to find out what's most important to the people you support, and we keep that at the center of everything we do. So, supportive partnership. We are now going to turn it over to Albertina Kerr to answer a few questions about that. So how did CQL work with your team to understand your unique needs and priorities?
Yeah, CQL really took the time to get to know our agency. From the initial meetings and trainings to their thoughtful review of our self-assessment, the focus groups and site visits they completed during their in-person assessment, in addition to the in-person trainings offered beforehand, allowed them to fully interact with our staff and people supported to get the fullest picture of life at Kerr. Another huge piece was the self-assessment process. We here at Kerr have unfortunately historically compared our progress made against ourselves instead of outside trends and data. So having CQL's data supported basic assurances made it pretty evident where our strengths were and where we needed to shift resources to make systems and practices more robust and to better support our people. We have also previously judged our service quality based on our licensing results. While clearly that's important to meet, the CQL process has really redefined our North Star for service delivery, focusing beyond the minimum standard to a more holistic and well-rounded approach.
Wonderful. Thank you so much. My next question is, in what ways did CQL's lived experience in service provision add value to your accreditation experience?
Yeah, I think this was actually really great. It's very, very clear that CQL has significant expertise in this area, and they provided relevant and helpful suggestions for program improvement, everything from consolidating our records to staff retention strategies, and many, many things beyond that. And it's very clear that their expertise, having been in this field before, really shined through and made it a comfortable process.
Okay. And then what kind of ongoing support has CQL provided since your accreditation visits?
Oh, it's been great. CQL has been very, very good about communication with us, and has been really responsive to any and all of our questions that we've had since the accreditation process. They have been very forthcoming in sending resources or templates for documents or procedures that we did not have, which was really great because it gave us a starting point to develop new procedures. And also, funny enough, in the middle of our accreditation process, Kerr merged with another agency, and it was a pretty drastic merge. CQL was very flexible and accommodating to providing extra training and support to help us bring the new merged staff up to speed on the CQL process, included them in a lot of the new trainings, and they were very flexible with that drastic change.
Well, thank you, Caitlin. Appreciate that. I am now going to throw it back to Elizabeth.
Hey, thank you, Nikki, and thank you, Caitlin. That was wonderful. One of our partners has said that CQL always challenges us to look at our service and supports through a lens of appreciative inquiry. And that's part of what we're going to talk about when we talk about focusing on results. Now, CQL accreditation is not a deficiency-driven process, not in the least. We work with organizations to improve supports by applying areas of excellence to areas of improvement. We help leverage the strongest aspects of your agency for services where growth is needed. We want to know what you feel are your strengths so we can work with you to affect change where it may be needed. Our partners describe other accreditation entities as having a punitive approach. CQL, again, accreditation is not deficiency driven, instead using the concepts of appreciative inquiry for a collaborative, supportive, and encouraging experience. We work with partners to identify pockets of success and explore how those can be applied to areas where there is opportunity for improvement. When we hear about the victories in your organization, it helps the process in partnering to create accomplishments in other areas of your organization. It also helps us to be able to share successes with other organizations that may need ideas and in turn share successes with your organization where others have succeeded. Our goal is to celebrate the great things and inspire you to keep up that momentum in areas where there is work to be done. This is not at all a gotcha experience. So, to find out a little bit about the CQL approach with Albertina Kerr, I have a couple questions for Owen. The first one being, what aspects of CQL's approach did you find particularly effective or unique?
Yeah, thanks, Elizabeth. So, Eli and Caitlin have touched on some of these that I'm going to talk about. However, I think they're worth mentioning again because really they were core to our experience with CQL. So, as Caitlin and Eli noted, the self-assessment process was really helpful in identifying our strengths and opportunities across the agency. So we've had internal licensing oversight in our programs for years. So we had our own internal QA program that really did a good job of making sure we were aligned with Oregon administrative rule. But we really didn't have a good process to understand the person's experience and services. And I think that was really key that while we really met the administrative rules, that didn't really lead to a strong strength-based person-centered approach and a really clear understanding of the person's experience in our services. So I think a really big key of this is the CQL self-assessment process. And we got a large group of staff together, from direct service staff to leadership to HR to accounting to facilities, to go through this. And so our facilities and accounting departments had never been involved in, like, how do you integrate person-centered care within their operations? And if you really think about it, facilities and accounting, they actually have a significant impact on the people we support. So for accounting, and we manage a lot of person's money through holding their personal accounts. And then, given how many group homes we have, the facilities department really has a significant impact on how people live. So, this broad approach really helped to ensure that all CUR staff are all on the same page. And so, the self-assessment, it's a big commitment. However, it really helped shape our quality and operational initiatives. We also really appreciated the upfront training on person-centered thinking and also the QA standards because it really helped us understand CQL's approach to the accreditation process. That made our self-assessment process even more effective as the training really ensured that we were all on the same page and really looking at the basic assurance measures all in the same way. We also love the concept of the PALMS data. We've just sort of now started that process, so we're not too far into it, but using that to understand how do we support people on our services and also better understand their experience. As a self-proclaimed data nerd, I'm very excited to see the data from CQL and PALMS and really highlighting our good work and also our areas of development. And I think, again, looking outside of CUR and even outside of Oregon of, what is the national standard or the global standard is really going to be invaluable in seeing that do we need to improve compared to other high functioning agencies.
Thank you, Owen. How did the experience of working with CQL compare to your expectations based on prior accreditation experiences?
Yeah, that's a good question. So, IDD services at CUR have not been through an accreditation process prior to CQL. So, as I talked about earlier, we we used to have sort of two divisions, but essentially we have a mental health wing of CUR and an IDD wing of CUR, and we're much more unified now. But essentially, our mental health wing has been accredited for 20 plus years through a couple of different accreditation bodies. So I would say the significant difference was CQL's approach to the process, which created a really positive atmosphere during the accreditation. So the process was really more about leveraging what we were already doing well to help facilitate positive change in the areas where we really needed improvement. So overall, our work with CQL was much more collaborative, which I think really led to a much more open and honest conversation with the folks that came out to do our visit and also in our results. So, with some of our other accreditations, and I'm not going to name which one, I think the approach felt more like a gotcha process, and the focus was more around if we had the required policies, and really there was just a lot more focus on our facilities. I still don't quite understand what a sprinkler system standpipe is. However, the surveyor from the other accreditation body was really fixated on our inspection logs for that system. And that's what the visit was really, it was very facility focused. There was not a focus on the person's experience. And those aspects of our operation almost seemed like a footnote to the visit. So CQL was very focused on the people we support, and that's where we wanted the feedback, not about our sprinkler system.
Thank you, Owen. You will never receive that feedback from us, so you will not have to worry about that. So, by incorporating the measurement of the presence of basic assurances and the POM into our quality monitoring report system and strategic priority reports, one organization said it has been able to ensure one clear and transparent path for the organization, partners, and stakeholders. So, of course, we're going to talk a little bit about data. And, no one likes to collect data just to collect data. In the work that we do, we're usually required to collect data for many reasons, tier levels or goal tracking or payments. But when you partner with CQL, we build upon that and ask, are those numbers important? Of course. But CQL wants to help you discover data that truly becomes a tool to more efficiently and effectively support people to live their best life. Organizations can use data collected through CQL tools to inform their decision-making and assess the return on their investments. For example, where is the data showing we need to focus more training on with staff? Organizations can use data to highlight different program areas that are positively impacting lives of people. CQL also helps create a bridge between data you may already be collecting and how to connect that data to the lives of the people you support and to organizational improvement. At an individual level, the information and data can direct person-centered plans and track progress. Organizationally, the information can be used to create an efficient plan for organizational change. With CQL accreditation comes complimentary access to our portal data system during your accreditation term. And with the use of the portal data system reports, your organization can compare POM data to national benchmarks, as well as creating reports for your organization to discover pockets of excellence or areas that may need to be addressed. Now, partnering with CQL also means having access to cutting-edge research in this field. CQL has a dedicated research director and staff that publish white papers and scholarly journal articles that consistently show the data behind why CQL practices are affecting real change for people. CQL uses data within the portal system to provide real numbers behind subject areas, such as the social determinants of health, to impact change on a systemic level. The U.S. Centers for Medicare and Medicaid Services, CMS, is acknowledging the personal outcome measures created by CQL as a nationally recognized quality measure. Released in July of 2022, the HCBS quality measure set intends to help states and the disability service system evaluate and improve quality for those receiving home and community-based services in the United States. In the guidance, CMS has included specific indicators of the POM as measures that the disability services system should use in their efforts to monitor and enhance quality. When you partner with CQL and commit to using data for quality enhancement, you are creating several things. Number one, credibility and trust. This showcases your commitment to quality to stakeholders. With CQL's data-driven emphasis, you can benefit from the partnership by highlighting your accreditation with CQL in fundraising campaigns, grant applications, etc. You can display the CQL accreditation logo on your website and in marketing materials. Another thing that you're doing is you have those insight and metrics, leveraging accreditation findings and insights for strategic planning. You know, what will you be working on as part of the accreditation plan will truly help focus your strategic plan with that ability to use data to illustrate positive change to stakeholders. And you can also utilize accreditation related data for organizational decision making. Another provider said that in 2014-15, they were struggling on how to implement the HCBS settings final rule. CQL seemed like an excellent roadmap to truly living the full intent of the rules. So using CQL tools and principles resulted in an agency shift, and so many good things happened. So back to Q&A with Kerr. Eli, how do you foresee the partnership with CQL affecting the collection of meaningful data?
Yeah, you know, I think a lot of it is obviously you all have offered us various trainings like on the Palm, for example, and access to the portal data system, which is super helpful. And, you know, as Owen kind of previously touched on, we've historically compared ourselves to ourselves and didn't know like where, you know, we should be looking at growing, where our strengths were, things like that. So I think access to the data CQL has already collected is going to be really helpful to compare ourselves to national standards to see where we have those opportunities for improvement, which is something we really haven't had access to before. In addition, kind of comparing at where we are in terms of the basic assurances, I think it's also helpful to make, you know, educated decisions on what we need data on and what we don't need to spend like time and resources looking into. So that kind of like efficiency is also really important.
What do you feel are the advantages of using quality measurement tools provided by CQL, such as the personal outcome measures?
Yeah, one of the things that I like in particular about personal outcome measures is that it's person-centered, and I think it's very cool that, you know, CQL practices what they preach when it comes to that. So it's not an assessment that's, you know, like so many other assessments we do, which is like, let's look at the documentation on this person, let's go to their team, let's go to their family. It really starts with the person first. What are their thoughts? How are they feeling before we branch out? And that is really cool to me. Another thing I like a lot is the separation of outcome present for the person versus support present provided by the agency. I think this helps us determine where we may be over supporting or not providing enough support. So it really shows us exactly where we need to be providing like more resources and supporting people better, or maybe where we're doing already a good job. And so once again, the efficiency comes into where it's like, okay, I don't need to focus on that, you know, this particular aspect so much. And I think, you know, also it's just such a relief to have a system that's already been made and tried and tested. This saves a lot of time and resources we would have otherwise spent reinventing the wheel. And we also get to now just jump in and begin using these resources right away, which is really awesome.
Thank you so much, Eli. Accreditation from CQL, according to one of our partners, ensures that person-centered support services and best practices are at the forefront of all that we do. And this comes to kind of the last area that we want to talk about as far as the benefits. We've talked about so many already, but the bottom line is the CQL differences that we do prioritize people. It says it in our vision. It says it in our mission. It's one of the things that we do best. It is all about creating real lasting impact for people. We believe that accreditation should be meaningful, not just a requirement. And again, this is reflected in our vision and our mission. We absolutely believe in people over paperwork. We certainly will look at organizational systems, including policies and procedures and other documentation. We also look for robust practices to be in place across all services and departments. We want to see that organizations are not just talking the talk, but also walking the walk. It's all about fostering a culture of continuous learning and professional growth. This is not just about those receiving services, but also for those providing the services and supports to them. Through education and research, webinars, and guidance, CQL offers ongoing support to its partners in a variety of different ways. Now, so looking ahead, Caitlin, in looking ahead, what gets your organization excited about the future?
Yeah, you know, based on the feedback that we received after the accreditation process, CUR has developed and implemented a human rights committee. And we've also started a campaign to educate both our staff and the people we support about human rights and the rights of all people. And, you know, even in the early stages, we have already seen some positive feedback with these campaigns. Um, there's been a lot of communication and strong interest in furthering this training and knowledge across all of our services. So that's been something that's been really exciting to see people really wanting to expand their knowledge, not just the staff, but the people that we support. Um, we're also really excited about the knowledge and resources that we've gained through this process, which is guiding us and providing a much more person-centered approach to our services. This includes finding ways to help the people we support really drive their own services, making decisions for themselves, and being the focal point of their planning and life goals. The CQL practices to collect data and analyze agency trends, such as the personal outcome measures that we've talked about. These are new tools for us to collect and track data and trends, which guide us on where to put our resources and, you know, where we can improve and what people we support are lacking in or thriving with. And, you know, lastly, CQL has provided us with a lot of insight, tools, and support that is continuing to guide us towards providing a much more holistic, much more person-centered and well-rounded supports, which in the end leads to happier people throughout all of our service lines. And that's, of course, the goal that all of us want.
Thank you, Caitlin. As a member of the CQL team that has had the honor of working with Albertina Kerr, just hearing what you just said makes me excited about Kerr's future as well. So again, this just, you know, goes to show that CQL does get excited about organizational successes. We love seeing the growth in organizations that we partner with. And so, Caitlin, what would you say to an organization considering a partnership with CQL? What should they know?
Well, yeah, you know, I think this, I'll kind of piggyback off of some of what Owen had said. You know, some of our previous accreditation processes that we've completed have not been anywhere near as thorough and definitely not as person focused as the process that CQL has provided. It really is clear that all of their employees are not only incredibly knowledgeable and passionate about their work, but they all have real world experience in these services. And to me, that brings just a much more dynamic and way less clinical lens to their approach, and focusing more on the overall well-being of the people that we support and how our services impact them day to day. I think CQL is a great choice for any organization that is wanting to improve their services, learn how to streamline their resources, and learn all of the best practices to really ensure the highest quality of life for people they support, and as well as for everyone in their agency, including staff. So you guys have been great in pointing out that, you know, the best services are provided by happy staff as well. So giving us tools and resources to really educate and uplift our staff, I think, is another thing that sets CQL apart from a lot of the other accreditation organizations.
Thank you, Caitlin. Much appreciated and great insight for other organizations. So, of course, as we are coming to the close of the webinar, encourage anybody, any of the attendees to post in the chat box or not in the chat box, but in the Q&A, any questions that you have for Albertina Kerr and their experience. Part of the continuous learning and growth that we talked about and that Caitlin mentioned again includes the many resources that we share via email. And those, of course, we're going to encourage everyone to sign up and get those resources sent straight to your inbox because there are just so many of them. Additionally, of course, so we want to encourage people to follow us on all our social media accounts. We also have a great e-community on Facebook where organizations can share resources and connect to our accredited providers. I'm not personally on it, but I know that there's a lot of action that goes on that e-community, a lot of learning and a lot of sharing of resources. So that's always great to see. So I think we're at that point now where we will turn it back over to Seth and see if we have any questions that have popped up for either CQL or Albertina Kerr.
Thank you, Elizabeth. And as people are putting in questions in the Q&A, just a few little reminders. We will be following up with all registrants of this webinar, whether you attended or not, in a few weeks, and that'll come via an email, and that'll include links to the webinar recording, as well as a PDF version of the PowerPoint slides, as well as various links and resources and information that we sent out today. Monitoring the Q&A, I'm not seeing any questions come through, which is always a sign that you all covered everything that anyone could possibly want to know about this topic. So no questions that came through quite yet. But we do, of course, want to thank Albertina Kerr for some great insights into their experience with CQL accreditation, and of course, our presenters today with all the great information that they gave. So really,
yeah. I just want to add that back onto Seth, piggyback what you have said. Thank you so much to Caitlin and to Owen and to Eli for sharing their experiences. And it was great to hear some of the things that you guys have been up to since your accreditation last fall. So it was nice to hear all that. And Nikki, thank you as well. We appreciate your insight and another team member to CQL that is just very passionate about the work that she does. So Caitlin, Owen, Eli, anything you want to share before we, I think, close out maybe for the day?
Yeah, I would like to just really quickly shout out your guys' YouTube channel. I have, I've been doing a lot of the rights updates and stuff. I've stumbled across some really great videos on your YouTube channel. And I think that a lot of them, they're not only helpful for staff, but they're understandable and digestible for the people we support. So just a shout out to that YouTube channel, and as well as all of the resources through your emails. They're great. You guys have a lot of great resources that I think people can benefit from. So just shouting that out.
Caitlin?
All right. Yeah, and I just want to emphasize, I think the thing that I most greatly appreciate about CQL that I is really it's much more of a partnership than an accreditation relationship. I really just appreciate the back and forth and the openness and willingness to just have those conversations. And it's not about, these random people that show up every 3 years to do a 3 or 4 day visit. It's much more of it's a very different relationship that I think we've really come to appreciate.
Fantastic. Thank you so much, Owen. Okay.